Hey folks, Joyce here, certified health and nutrition coach. Thanks so much for stopping by. November is Diabetes Awareness Month, so I'm covering a bunch of topics relating to diabetes. So check out my last two videos, link is above and in the description below. But today we are talking about pre-diabetes. So just to give you a little bit of context, 1 in 10 Americans have diabetes, but there is a scarier stat than that, and that is 1 in 3 people have pre-diabetes, and of this 1 in 3, a whopping 80% don't know they have it. So to me, that is a huge number and a huge opportunity. So if we can identify whether or not we have pre-diabetes, we can really reduce our chances for getting type 2 diabetes and all these related medical complications and loss of quality of life in the future. So if y'all are with me, please keep watching and let's dive into some of these numbers.
I really enjoy this infographic by the CDC that has data sourced from the American Diabetes Association because it shows various ranges of what is considered normal, pre-diabetes, and diabetes. And we're talking diabetes here, so we are talking about sugar in the blood. All right, so an A1C test is different from all these other tests that looks at sugar in the blood. So A1C is the percent sugar in the blood over the past 3 months. So it's an average. Then we have the fasting blood glucose test, which is basically what is your blood sugar before you have a meal. And then the glucose tolerance test is what is your blood sugar look like after a meal. So these two columns right here is a snapshot of present time, whereas the A1C test is an overview of the past 3 months. Okay, so we are looking at A1C today for normal, and that is below 5.7% of your blood has sugar. Now with pre-diabetes, it is 5.7 to 6.4% and includes 5.7 and 6.4%. So if your blood sugar is in this range, then that means you may be diagnosed with pre-diabetes, okay? And higher than that is 6.5% or above is considered diabetes, all right, for your A1C test. And when you're looking at the fasting blood glucose or the glucose tolerance test, here are your numbers. And as you can tell, the normal is lower than the pre-diabetes, and pre-diabetes is in between diabetes and normal blood sugar. As your advocate here, I just want to tell you that when you get back from your doctor's office and get your lab results, to take a look at it yourself and look at these numbers and compare it to what you have. Because the physicians or nurse practitioners may not necessarily tell you you have pre-diabetes. And why that is, I have no idea, but it has happened to me, and this is why I do what I do. And my number was actually 6.4%, which is 0.1% away from being diagnosed diabetes. And I brought it to the attention of my physician who ordered the labs, and he said it wasn't a big deal, and I was really upset about that because I have shared that my family history is steeped with type 2 diabetes and heart disease. So please don't take their word for it. Be respectful, but also advocate for yourself and just be aware of these numbers. So again, you can prevent getting type 2 diabetes if you are at high risk. According to the CDC, the risk factors include your weight. So if you are overweight for your age, your height, your body type, that is a risk factor. Your age, being 45 years old or older, having a close family member who has type 2 diabetes, like your parent, brother, or sister. If you are not really active, which means that you are moving less than 3 times a week intentionally, that is also a risk. And if you've ever had gestational diabetes or you had a baby that weighs more than 9 pounds, those are also risk factors in addition to your ethnicity or race. So if you're African American, Latin American, Hispanic, Native American, Pacific Islander, Asian American,
increase to getting pre-diabetes. And if you're curious about your risk for pre-diabetes, there is a risk test that you can take on the CDC website. I put the link in the comments below. And if you have any questions about pre-diabetes and want to know what you can do about it, please contact me. You can also comment below or DM me on Instagram or Facebook at Kala Health and Wellness, or email me at jm@kalahealthandwellness.com. So thanks so much for watching. I hope you all really learned a lot from this, and also spread the word, because we want to know whether or not we have pre-diabetes, right? So thanks so much for watching. If you enjoyed this video, give it a thumbs up, share, or hit the subscribe button if you haven't already. And if you have, thank you all so much. See y'all next week, and remember, you deserve to be